Before and during labor, your body has a lot of work to do to prepare for the actual birth. The one thing that we hear about the most, I feel like, is the cervix. The cervix changes in several different ways to prepare for labor. It actually changes in 4 different ways, so I'm going to talk about those. The first thing that it does, it has to ripen or soften. So it needs to become very soft to touch and pliable. And when your medical provider does exam, they can kind of test that. But in order for you to get an idea of maybe what that feels like, I'd like to just kind of show you just a little demonstration, and you can do it on yourself. But if you feel your nose, the tip of your nose, it's pretty hard and tough, and that's kind of what your cervix feels like all the time when you are pregnant, or when you're pregnant, when you're not pregnant, things like that. And when you feel your earlobe, you can tell that it's very soft, it's very pliable, very you can move it around, and that is how your cervix needs to feel in order for labor, birth, things like that to take place. So that's what your cervix should feel like. Like I said, when your medical provider does an exam, he or she'll be able to determine that. The next thing that a cervix does, it has to thin out, or it has to efface. The cervix is very long and thick, and it shortens and becomes very thin, and it has to all the way before giving birth. A lot of times doctors will use the term 50% effaced. That means that the cervix is it's pretty thick at first. That means it's thinning out, it's stretching out to become a thin layer, so that way it can dilate to where it needs to. The next thing that a cervix needs to do is change position. So there are 2 positions that a cervix goes into whenever you're going through the labor process. If you put your hands like this, my hands up here is going to represent, or kind of like this dome that I'm making is going to represent the uterus. And at the bottom here, this is going to represent our cervix. So actually, as you're holding it right now, the back of my fingers, the cervix, not my fingers, the cervix is pointing towards the back of my body. And that is called the posterior position. The cervix is pointing towards the back of the mother. In order to give birth, the cervix needs to move from posterior to anterior position. So the uterus and the cervix is all going to rotate to the front of the mother in order to give birth. Now, usually this happens obviously during labor for this to happen. And that's just part of the contractions and everything that happens. So right now, posterior position, and it has to move to anterior position to the front of the mother. So that is the position of the cervix. The last thing, which I feel like is probably the most common thing that you hear about, is dilation. So your cervix, not only does it have to become very soft, very thin, it also has to widen. So it has to go from 0 centimeters to 10 centimeters. And so what I will kind of go through like a little demonstration just to kind of show you all of those things together and what that needs to do. So put your hands back in this position. So your uterus is very, it's tight, it's normal. Your cervix is completely closed shut. So this is 0% effaced. It's very tight. It's very thick, and it's in the posterior position. As the uterus contracts, it will pull apart, or it will affect the cervix each and every time. So contraction, cervix becomes a little bit thinner, a little bit more wide and open. Contraction again, and it's starting to do the same thing, and it goes back to normal. Contraction again, and it kind of is starting to move. And it also, during this time, not only is it doing all those things to the cervix, it's moving it as well. So it's moving from posterior to anterior. So the more it moves, the more the cervix dilates, become effaced, And thumbs up.